For CBC, she's already had a CBC at the clinic.
If you want to get a sense of the problem, just go to a local hospital emergency room. It's a weekday afternoon at Scripps Mercy Hospital. Dr. Ronit Lev looks at a computer screen that lists all of the patients in her ER.
We have 55 people in our emergency department right now. I see there's 2 people here on a psychiatric 5150 hold. We have a person here with anxiety. If I scroll down, there we could see here suicidal, 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 suicidal.
In a different part of the ER, Dr. Lev stands outside of a room that used to be dedicated to cardiac patients.
Now we've moved them upstairs and we have 4 dedicated beds in a locked area where we have psychiatric patients, and they're there 24/7 with a dedicated psychiatric nurse.
Lev says this room is full 7 days a week. Other psychiatric patients are spread throughout the unit. In the last few years statewide, the number of psychiatric cases in ERs has skyrocketed. In some places, 1 out of 5 patients has a psychiatric issue. The increase may be due in part to the Affordable Care Act, which has allowed millions of additional Californians to get Medi-Cal coverage. Lev points out ERs can handle psychiatric emergencies, but they're not designed for people who need continuing acute care.
It's a chaotic environment, there's lots of distractions. It's the absolute wrong place for a psychiatric person who's psychotic and gets to hear all sorts of voices around them.
Here's how the mental health system is supposed to work. People with mental illnesses can be treated at community clinics or doctor's offices. People in crisis can be stabilized at ERs and then discharged to psychiatric hospitals or other locked facilities that can provide acute treatment. Some of those patients may still need an extended period of care, for which there are long-term care facilities. The problem is nearly all of these places are full. That includes the county's psychiatric emergency hospital on Rosecrans Street.
Sharp Mesa Vista Intake, this is Kathy. How may I help you?
And Sharp Mesa Vista Hospital, the largest private provider of psychiatric crisis services. Mesa Vista's medical director, Dr. Michael Plopper, says the system doesn't have enough capacity.
So all of these places that we typically send our most seriously mentally ill are impacted. So we're backing up in the hospital because we can't find appropriate placements in the community. And then the emergency departments are having difficulty getting the patients into our facilities because we don't have the space.
Michelle Acoy lives in the South Bay. She was diagnosed with severe depression when she was 16. In 2009, after going off her medication, Acoy spent a month at Sharp Mesa Vista.
When you're in a manic episode, it's very intense. I didn't even know I was bipolar at that time, but I started like hallucinating, and I was hearing things and seeing things, and I was very delusional.
Acoy was discharged and soon had another manic episode. She was admitted to another hospital and diagnosed with a severe condition called schizoaffective disorder. The hospital wanted to send her to the county's long-term care facility in Alpine, but there were no beds available. Her mom, Mitzi, says watching her daughter languish was horrible.
Bipolar depression it's overwhelming. And there's a lot of struggles in it. And I want the best for her, but you can't get the help.
Michael Plopper says it's a matter of misplaced priorities.
I think our most seriously mentally ill have not gotten the attention they need in this county. And we're suffering the consequences of that.
Tomorrow, we'll take a look at what the county is doing to improve services. Kenny Goldberg, KPBS News.